This segment of the Plastic Surgery Channel is brought to you by Galatea, now offering Galaform, the first 3D mesh for soft tissue support.
Dr. Bill Adams here. This is No Spin Live, everybody's favorite show where you get the latest information from the world's top plastic surgeons. Today we're going to talk about some great topics. Another BBL death, anesthesiologist charged, a doc carves his initials in a patient's liver, and Iggy Azalea's curve. We got a great crew with us today. From Boca Raton, Florida, we got Dr. Jason Posner, JP.
And Cici.
From Fort Worth, Texas, we've got Stephen Camp. Steve, how are you?
Doing great.
And last but not least, we've got from Austin, Texas, Dr. Rob Whitfield.
Got 3 Texans against the Floridian. That's bad.
All right, well, listen, let's get into it. This first one, there's been another BBL, Brazilian butt lift death in Florida. This is in Miami-Dade County. You know, there's a lot of questions. The story says there's questions that are, and there always are. It's always a tragedy, but I think there's some take-home lessons that we continue to learn and patients need to be aware of. So Jason, start us off.
You know, we've been through this numerous times before on the Plastic Surgery Channel, and if you Google it, you'll see a lot of stories about this, and they're all really similar. It's usually at a clinic, at a fast food plastic surgery clinic. The doctors seem to be well trained. The patients are often traveling from somewhere else. But the bottom line is it's a low-cost procedure done at a place that probably I wouldn't send any of my family members to.
Steve, what are your thoughts on this whole deal?
I think it's along the same lines. You see a lot of these advertisements for really great deals all over the place. And every once in a while, I'll have a patient that comes into my office looking for a fat grafting procedure, and they'll tell me that they have prices that are almost unbelievable. And so it leads you to believe that, you know, in some of these places that aren't accredited surgical centers, that don't have the right staff and anesthesia, that they're cutting, you know, costs and cutting corners. So really what Jason said is absolutely true. Find a board certified plastic surgeon. Find a place that's a reputable surgical center too. I think patients often forget to look at where they're having the procedure. And so if you go to a hospital-based outpatient surgery center or a fully accredited surgery center that a board certified plastic surgeon would use, you're likely going to be in good standing.
We've learned it's really more a technique-related issue where fat gets basically embolized through the big veins in the pelvic area up to the lungs, and that's why these people die. So speak a little bit about that, and what else do you think patients need to know?
Sure. I mean, we recently updated our thoughts on this in the Aesthetic Surgery Journal this fall, and we feel like the position of the patient, the size of the cannulas, the understanding of the anatomic region, you know, prevents many of these potentially dangerous situations. So this is not a procedure that's taught in a weekend course or a seminar. This is something that should be, you know, thoughtfully done by plastic surgeons in accredited surgery centers. There are very real and significant complications, including death, that can happen from the procedure if not done properly using the appropriate technique and instrumentation.
The second story is another thing that came up on the radar that somebody had emailed in. It's about an anesthesiologist that was charged with a patient murder, and this is a procedure was done, and apparently there was an overdose, it sounds like, in the recovery room. You know, I guess, you know, one of the things, and Rob, I'm gonna stick with you, you know, one of the things people always, a lot of times patients assume that doing things under local anesthesia or IV sedation is safer than when you have a general anesthesia, and I'm not sure that's necessarily true, but what do you think the takeaways for the patients are in this story?
Yeah, I think we've discussed this in the past, and conscious sedation is more risky to me than general anesthesia because you don't have any control of their airway. So patients become hypoxic, or due to a lack of oxygen, you know, have an arrhythmia or something else go wrong, and then you can't resuscitate them in this case.
Absolutely, and I think that sometimes people get relaxed in an office setting or in a situation where they feel like not all the connections and monitors are in place like we do when patients undergo general anesthesia. So, you know, it's just, you always have to be careful. And, you know, it's somewhat related to the butt lift thing that we were just talking about a little bit, Bill, from the sense that it seems like it's a surface procedure. It seems like it's not as deep or invasive. We're not, making incisions in the abdomen, but it's real surgery with real consequences. And being in a place where people are going to be very specific, detailed, and thoughtful about taking care of you is just as important as ever.
So do you think patients need to research their anesthesiologist, or is it, what I usually seems like if you pick the right surgeon, the surgeons often sort that out for the patient, but what do you think? What do you think? What do you tell your patients?
The story is a little more complicated than this because this was not a death in surgery. This was a death in the recovery room, and the anesthesiologist was implicated doing drugs themselves. The anesthesiologist was doing drugs, and then they overdosed the patient. So this was a really messed up situation. I mean, so something that probably is once in a lifetime thing that you would hear. However, you bring up valid points about the physician and the staff. So we run a Quad A center in my office. I have a board certified anesthesiologist, MD, same doc who works with us every day. He looks at the charts of the patients beforehand. We clear everyone over 40 needs a clearance. Our in-office protocol is if you're over 60, you generally get a stress test. So what we do is we're very strict here, and the issues are, even with that, things can happen.
Yes, to say that again. All right, well, let's move on. I'm going to stick with you, Jason. And actually, Jason, you sent me a story today that goes perfectly with this one. This is a really weird deal. I saw this I've never heard of this. Doctor carves his initials on a patient's liver during surgery. And Jason, you sent me one where somebody put their logo on a patient's uterus. This is the most bizarre thing I ever heard, and it's 2 in a day.
Right. Well, the other one was from 2003 or 4, but I remember the story. The old story was this guy from University of Kentucky was putting his UK initials into a uterus as he was taking it out, and that was a specimen. So he put it in, and then it would be on the specimen. Okay. This new story is the guy was using an argon beam laser and carving his initials in an intact liver. I mean, you got to be kind of nuts to do something like that. So I think that, maybe this was an impaired physician doing this, I don't know, or someone with an inflated sense of ego. But these are pretty stupid stories. And, these people kind of need to, be whipped a little for this.
Yeah, it's Steve, you ever seen anything like this?
I think as plastic surgeons, it's so counter to what we do. Most of us want to hide the evidence that we've been there. I think the last thing any plastic surgeon will want to do is leave their initials on the cheek of a facelift patient. So it's absolutely, I think, inappropriate. It's unbelievable, really.
Yeah, it's it's a little bizarre. The closest thing I've seen to this is we were doing a live surgery symposium a long time ago, and there was a visiting surgeon who was doing a rhinoplasty, a very famous surgeon, and he kind of etched his initials into the plaster cast on the patient's nose, which we thought was really kind of odd, but this is really out there, Rob, don't you think?
Yeah, it's ludicrous. I mean, this is not surgical behavior. This is mentally imbalanced behavior.
Yeah, and the story doesn't really provide us with a lot of the details. Who knows? I mean, I'm not sure who these guys are, what their credentials are, but I mean, it's so far out there that it's not the norm for sure. So Rob, last story is a little bit on the lighter side. We've had all these serious stories, but this is about Iggy Azalea, and people, a lot of the people out there see all these pictures she puts out there, and most people assume she's done some plastic surgery to get these curves that she has, and I guess she's claiming she's never done anything. So I'm going to use you three experts to tell our millions of viewers what the story is.
Has she had anything done? I mean,
do people naturally have butts like that?
No, not typically. So yeah, I mean, it looks like it's been augmented. I'd be surprised if it wasn't. That being said, I mean, she has a great figure that she feels very comfortable with, so it's fine. More
power to her. Steve, what do you think?
Yeah. I actually read the story. I don't know much about the background of it, but she has portions of the story where she's very adamant about coming clean about what she has and has not done. I think I've even seen her pose with her plastic surgeon on Instagram, on one of my Instagram feeds. You know, I think she was kind of being a champion of feeling good about herself and about what her viewpoint on aesthetics is. And so I say cheers. I thought that the article was good and fair from her point of view.
JP, you know, we talk about some of this stuff frequently, and we always say it's like the attention getters. Like, is this just a publicity stunt to get more publicity about stuff?
You know what? I'm going to give you my usual line on this. Like, I really don't care. You know, she has a big butt. She looks pretty good. I don't care if she has something done or not. I really don't. If it floats her boat, good for her.
Incredible insights. I'm sure our viewers enjoyed it. And if you want to see more of this, you can see it on theplasticsurgerychannel.com.